Good morning. Apologies to anyone who's seen me present about PAWS-GIST previously. Some of this at the beginning will obviously give you a little bit of background, and then I'll move on to perhaps more interesting developments of late. PAWS-GIST stands for Paediatric, Adolescent, Wild Type and Syndromic-GIST. So obviously the paediatric bit covers for the younger patients, and so do the adolescent, but there are many, I say many, there are probably more than we imagine patients who are in an older group who are wild type GIST, and the characteristics of their GIST are similar to paediatric GIST, most of whom are also wild type GIST, which basically means, as far as I understand it, that so far there hasn't been a mutation found to identify, or an identified mutation found, so that's why they're classified as wild type. Right, so bit of background first of all. When my daughter was diagnosed, obviously shocking scenario, couldn't quite believe it, and was very fortunate that a friend of mine put me in contact with GIST Support UK and Judith, and that helped to give us some hope that actually there was a future, a brighter future than this devastating story that was sort of given to us about the fact our daughter had cancer. So we were fortunate to be introduced to the Hibberdine family and also the Macaulays in Scotland, who'd obviously had previous diagnoses with their daughters of GIST, and we concluded it was a shocking state of affairs from our perspective that there didn't seem to be anyone with a lot of knowledge about this particular form of GIST. I was fortunate in that Eve's oncologist did some research and pointed us at the NIH clinic that Bas Hassan was on about just now. They are a fantastic group of people. They're probably 5 years ahead of us. Basically, they started a clinic. I think they only had a very small number of patients to begin with, more doctors than patients showing interest in this particular form of GIST. And gradually, they've been running a clinic twice every year, each time bringing in 10 patients from around America and also abroad, because obviously we were in on the, I think it was the 7th clinic that they ran. So all of Eve's data, all of her tumour samples that are outside of her body are with the American team. And they've been doing all sorts of studies, and it was in the last year that they actually started 3 clinical research programs specific to this group of patients. So to begin with, it was a collection of an awful lot of data from each group of patients that came along, but they are actually in the process of doing a clinical trial of a drug called vandetanib, which is a new drug which they hope will be effective in paediatric GIST. Anyway, to move on, basically, having experienced that particular clinic, I had a long discussion with Dr. Soo-Young Kim, who was the coordinator of the clinic, and really debated, why couldn't we have something like that in the UK? And he said, well, I can't think of any reason why you wouldn't want one in the UK. Obviously, your patients there have exactly the same needs as our patients here, so, we could collaborate. So, we came back, discussed it with Judith, and we put together a letter which we sent to 33 doctors that we found on the internet that had GIST somewhere mentioned in their list of things that they were interested in. 11 responded saying they'd like to help, and Ramesh Balusu from Addenbrooke's Hospital offered to lead the initiative. So since that time, basically we concluded we had some aims. We wanted to make sure that there was a concerted effort to focus on this group of patients in the UK. We want to be able to define effective treatments. Obviously, our aim is that we want to make sure our daughters, our children, our loved ones live as long as possible, and that we have a cure for this disease, rather than just sitting here thinking actually nobody's doing anything and nothing can be done. We want to make it happen. So the actions we agreed, they're common sense really. Find out where all the patients are, register them, collect data. Ideally, somebody in the world needs to be able to try and grow a wild-type GIST cell line. If they can grow one of those, it's difficult because they don't grow that quickly, these cells. So Nobody's been successful in that aim at the moment. But if they can grow them in a Petri dish, then potentially it speeds up the sort of number of tests that can be done rather than just practicing on patients all the time, because you can do it in a laboratory condition, testing any number of different drugs. We want to get some research going. One of the worst meetings I think we had with Eve was when we were told there is no research going on in this country and kind of don't know what to do because there is no research going. So we want to get some research going, and we want to make sure that there is some kind of central place that when somebody is diagnosed with this type of tumour, that those tumour samples, if they're having a surgery of some kind, are actually collected in one place, so that when researchers are thinking, yes, we can do some research, there's somewhere they can go to get the raw materials to do the research, because a bit of a catch-22, they're rare in the first place, but if they're not somewhere where people can find them to do something meaningful with a reasonable number to work on, it makes research impossible anyway. So this really was our sort of list of actions that we started with in November 2010, which seems ages ago now. We've made quite a lot of progress, but obviously a lot of the stuff we've done up until April was kind of chasing around Europe, stalking doctors to sort of ask them, did they have any patients, did they have any interest, could they help us, and making connections and networking. So another important thing was obviously raising funds, because the target that Ramesh set was that we probably would need around about £40,000 to have that money in place to be able to have any kind of hope of starting a clinic in this country, because obviously with all things it needs money. So we have been fundraising, and Irene yesterday was very pleased to confirm that we have actually now beaten the £40,000 target, so we do have the financial backing to be able to fund the start of a clinic. Obviously we need to sustain clinics once we've started. Since April we've made some contacts that have been very useful. We've made contact with a group called eCancer, who are headed by Professor Gordon McVie, who's an ex-director of Cancer Research UK. It's a useful site actually. All of you might, if you're logging on at any time, might want to look at eCancer, because they have a search facility, and if you key in GIST, it will give you articles on all the latest GIST research that they've come across that's happening anywhere in the world, so quite handy to look at that every now and again. We were invited to represent GIST Support UK and PAWS-GIST at the ECPC Masterclass for Patient Advocates, another opportunity to network with European specialists. It's funny with these things, you don't always realise that anything beneficial is going to come out of it, but when you've been on them, you then discover that you've met people you wouldn't have possibly met in any other circumstance, and all of a sudden that opens up another avenue that's going to be of help. One of those sort of chance meetings was actually at the British Sarcoma Group meeting earlier on in the year, where I gave a brief presentation about the fact that we want to set up this clinic in the UK for paediatric and wild-type GIST patients. And Judith at breakfast had met a couple of researchers who happened to say they were growing sarcoma cell lines, and that they felt they were probably the only group in the UK that were doing this. And we discussed whether they were growing GIST cell lines. They said they weren't, but we agreed to meet. And in April, when I gave my last presentation, we were due to meet them in May. Well, Ramesh and I went to Sheffield at the end of May, and we had a tour of the laboratory and saw sarcoma cell lines being grown in a incubator and under the microscope. And the agreement that we've reached is that Professor Malcolm Reed and Dr. Karen Sisley are very happy to help us. There are obviously logistically some hurdles to overcome, because basically to be able to stand a chance of growing a cell line, they need to have the fresh tumour samples, and they need to have it ideally within an hour of it having been removed from the patient. So ideally the patient needs to be having their operation done in Sheffield. So we have one patient who's she's on the Mail Talk, and she's recently had an operation, and she lives in Bradford, and subsequent to that operation has now been diagnosed as being wild type. So basically her medical team and the team in Sheffield are known to one another now. So at some point in the future, should she be due to have any further surgery, which is not impossible, obviously they're in contact, so that potentially there's an opportunity to use any future tissue samples to try and grow cell lines. But if you hear or know of anybody geographically that is a wild type patient that might be having a possibility of surgery, then if we can coordinate that, that obviously opens up a huge opportunity to try and get that level of our research going. In terms of a national GIST tumour bank, earlier on in my last presentation I said that we'd very kindly, Professor Andrew Hall had submitted a proposal to the Ethics Committee. This is for a national GIST tumour bank incorporating PAWS-GIST. You know, we don't have that facility as a disease entity, and he and we thought it was inappropriate to just focus on PAWS-GIST. We need one for the whole patient group. And I'm really delighted to say that this week we've actually gained approval for a national GIST tumour bank. It will be hosted in Newcastle by Professor Hall and his team. And we had a discussion yesterday with the trustees. To begin with, we do need to provide or find some financial support to get this off the ground. So we have agreed that GIST Support UK will fund an initial amount to get this off the ground, and we have to put together a steering group and access committee so that they will approve when people approach the tumour bank for samples for research. There's an approval committee that determines is what they want to use the tumour samples for a good idea. But once we've got that group together, I understand that we can apply for support officially. So hopefully that will mean the tumour bank is then sustained for everybody to benefit. Obviously, we've been to things like the Human Tissue Authority Open meetings for More Network, and as a result of the presentation in April in Newcastle, I was saying that our PAWS-GIST group had a gap, and the gap was that we needed a cancer geneticist. And I was very fortunate that one of the patients from that meeting came forward afterwards and said he knew of one, and she actually had GIST expertise as well, because he was the GIST patient that she worked with. And her name's Fiona Douglas, so she's now part of the PAWS-GIST initiative, and coincidentally trained with Dr. Belusu, so they kind of got back together again through that connection. We have collaborated with Rare Cancers Europe. There are some leaflets outside. It's a European initiative led by Professor Paolo Casali from Italy. And the whole idea behind that is that all rare cancers, if you pull them all together, represent somewhere around about 22–25% of all cancers, but they don't generally receive that volume of funding from European sources. So the idea is to try and pull all the cancers together and have a bigger voice for what's going on in funding and clinical research in Europe. So we've joined that initiative, and the actual initiative was launched officially at the ECHO conference in September. That's also a presentation that's on the eCancer site, should you be interested. You can hear more about it. Fundraising has continued for PAWS-GIST and will continue for PAWS-GIST. If any of you should like to buy a raffle ticket for the PAWS-GIST Grand Raffle, which is happening in December, I have some that I can let you have afterwards, or if you think you'd be able to find other people who might want to buy some, that would be fantastic. We had another major thing which happened in Oxford recently, which was our first PAWS-GIST clinic planning meeting. I never thought it was going to happen. It seemed to be we've been talking about it, finding people, raising funds. When are we actually going to do something to kickstart actually putting a date in the diary for the clinic to happen. There are quite a few things that need to happen, but we've had a planning meeting. We're targeting that it will happen in the spring. I mean, we actually said the week commencing the 15th of April, but whether it will happen in that week, I don't know. That's what we're trying to aim at. We've got approval for the clinic to be hosted at Addenbrooke's Hospital in Cambridge. And there's a few hurdles to be overcome. One of the things is, for example, that each of the doctors that are going to be involved in the clinic, and there are around about 23 doctors that are part of our group, they've already been CRB checked, but apparently CRB checks aren't portable at the moment, so they would need to be CRB checked again to participate in the clinic. However, it seems that the government have recognised this, not for PAWS-GIST, but generally, that there's an inefficiency there when it comes to that type of thing. And there is apparently some legislation coming in the spring as well, which is to try and make CRB checks more portable. So whether those two things will coincide, I don't know, but it'd be nice if they did. So there's that type of thing. It's always administrative types of things that tend to slow it down, and they always take longer than you imagine, but hopefully we can overcome them and find a way to still go ahead with our plans. Oh, I've already done the stop press bit, you know, about the tumour bank. So the other thing I suppose that happened this week, earlier, Judith was mentioning that Rachel had this operation earlier on in the week. It happened on Tuesday. Ramesh Balusu was present at that operation, and basically the tissue that's been removed has been collected by Janet Shipley. It's been snap frozen and will be, I think, the first tissue to populate our PAWS-GIST and National GIST tumour bank. So that's progress indeed, that it actually all connected up. The other thing that we've been advised we should try and obtain, because it will make, I suppose, diagnosis and the route that patients then take once diagnosed with GIST more, what's the word? Maybe homogeneous, something that means that there's a recognised route when somebody presents with GIST where they should be sent to a specialist centre. We've been told, yeah, protocol, thank you, that's the right word. We've been told that what we need is specialist commissioning status. Yet again, we're trying to get specialist commissioning status for GIST, and that will incorporate PAWS-GIST. We went last year to see Professor Sir Mike Richards, and it was kind of put on the agenda, and I've been progressing things with him and with one of his advisors, a chap called Edmund Jessup, who I also met in Oxford earlier on in the year. Last week, he came back and basically said that the proposal is that there's going to be a clinical reference group, I think that's what CRG stands for, specifically set up for sarcomas. It's good news for us because obviously it means sarcomas are then going to get a particular emphasis within this whole reorganisation of the NHS. And so hopefully I'll be introduced to the chairperson of this particular group, and that will help with getting a specialist commissioning status, particularly for GIST patients. Looking forward, we're representing GIST Support UK and PAWS-GIST at the Sarcoma Patients Euronet Conference, which is in November in Italy again. It's useful because every time we go to these things, somebody else, somewhere else, has come up with other things that are of benefit, either in terms of treatments or I find out that there are more patients in a particular country with paediatric and wild-type GIST than was originally mentioned. I mean, I'm quite interested to know, do you have any paediatric or wild-type GIST patients in your clinic?
Not
No.
knowingly.
So they haven't all been mutationally tested then?
We haven't managed to persuade the commissioners to do mandatory testing.
No.
So we are looking forward to having sarcoma and GISTs specially commissioned
Yeah.
rare cancer. So
Yeah.
it doesn't matter where you are in the country, you have the same access to everything.
Yeah.
And you're not in the flotsam and jetsam of all the other initiatives that go on locally. So I hope that will mean it will be easier to identify these patients. There may be patients out there who we don't know yet.
Yeah, I think that's how it is. So, I mean, looking forward, we've managed to move things forward so that we do have sight now of a clinic. We do have the start of a tissue bank. We have got information about the fact that specialist commissioning and GIST is something which is on the cards. Obviously, we can only do more of the same. I feel like a bit of a worn-out record, really. I've been going on about this for the same, but we are actually seeing some progress now. I mean, the fact that we have a tissue bank will mean that hopefully we can publicise that fact to the whole of the medical world and all their patients, and then anybody in future, when they're having an operation, can actually stipulate, yes, sign the form, I want my tissue used for research, and I would like it sent to the National GIST Tumour Bank. It will help us all to help ourselves if we can communicate that and make sure everyone's aware of it. So that's the sort of latest on PAWS-GIST. Thank you all for your support, and obviously those are our girls. They still have their GIST tumours, or Eve does definitely, and obviously we want to find a way that means that they don't have to have them for the rest of their lives and they can live a long and healthy life. Thank you very much. Can I take that out or leave it? Okay. Oops. Oh, sorry, yes.
Are there any questions for Jayne? Or for Bass, as a sort of follow-up from what Jayne has said? Is there a hand? Sorry, I'm standing in the light. Was there a hand somewhere?
Yeah, I'll ask a question. So,
Yeah.
are we going to still try and link in with the NIH North America?
Oh, definitely,
Yeah.
yes. Yeah, definitely.
And share resources and so on.
Yeah, I'm hoping. One email I haven't sent yet is Dr. Soo Young Kim. They had budgetary cuts in America.
Yeah.
And his post was removed from the equation. But I'm hoping to invite him to come to our first clinic if he's available. And obviously, Ramesh has also been to the clinic, so that he's now connected with those specialists there. And there's also there's a professor in Dublin, Maureen O'Sullivan. She's part of their group, so it's kind of a stepping stone between the countries, etc. Definitely, we have to work with them because they are that much more advanced, and we don't want to waste funds on duplicating stuff that they've already done. We need to work collaboratively, so we're each doing something meaningful to add to the whole.
Can I just make a point about the wild type GIST and these SDH mutations?
I don't think they can.
This is the sort of absurdity of it all, because it turns out these mutations do occur in other cancers, adult cancers, for example. But if you study really hard a difficult and rare problem, you just don't know if it's going to spill out into the rest of it. It may be great for Alzheimer's disease or headaches, right? But it may actually be useful for other cancers. So it's not just the GIST population that this is important for. It's just as a general principle that these rare conditions can be so informative, not only for the patients that suffer from them, but also for everybody else that might benefit from that knowledge.
Any other questions for Jayne? Or for Bass? Where's the roving mic gone? Oh, I'm sorry, Linda. Sorry. Yes. You better hang on to this, Jayne. Yeah.
Sorry.
Yes, Jayne. When I had my liver resected in 2009, I signed up for it to go to a bank somewhere. Where did it go?
I don't know, but you should be able to track it, and at some point I would be keen that your sample, which will be somewhere, is transferred to the central bank, because it's such valuable and rare tissue. We need everything we can get.
done at Queen's Medical Nottingham,
Right.
and I turned out to be wild type. So
Yeah, I mean,
it could be floating somewhere in a bank somewhere.
it will be. It will be. I don't think they throw them away for quite a while, do they? If ever.
So one of the problems is exactly that, is that you consent to have the tissue taken and it goes into a bank and then you never know anything more about it. But it's your tissue, right? So it's a bit like saying, listen, I'm going to take your salary and when you want to buy a car, just give me a line, drop me a line and I'll give you the money. That's not right. And so in a lot of other tumour types and around the world, there is something now forming, which is this idea of a dynamic consent. So that if you consent to give tissue, it's a mandatory right for you to know where it is, right? And whether it's being used. And this, it's a bit like, if we can do it for the bank account with NatWest, we can do it for tumour tissue. It's the same idea, is that you can log in and say, right, where is my tumour and what's it been used for? And everybody has to write down exactly what they're going to use that tissue for and whether you've consented for them to use it in that way. And then you can work out if it's being used or not. And so, like a bank, if you've put an investment into a tissue bank, you want a return. But if over 5 years they've not added any interest to your material, you have a right to move that tissue into another bank, right? So if you own the wild type tumour tissue and you wanted to send it to Ramesh or Dr. Sheffield or Janet or whoever it is, right? Because they happen to have a research project or that's going to be the Centre for Wild Type GIST in the UK, then that tissue should move on your behalf, right? So at the moment we're custodians, but you don't have this dynamic consent.
Just a bit of me residing in Brussels, apparently.
Are you wild type as well?
No, I'm
Oh, no.
not, but they took it and sent it off to Brussels, and I think I'm over there.
Oh, right, that's Maria, blah, blah, blah. I can never
Remember her
pronounce her
surname?
Yeah,
No.
can't pronounce her surname, but she's a lovely lady.
So
She's-
part, yeah. Well, at some point, obviously, it's very early days. So as I say, I've never set up a tumour bank before, so I really don't know what I'm doing. But it's a matter of finding and asking people who do know what they're doing. So at some point, I'm sure there will be some kind of announcement from us to say, right, if you can possibly locate where your tumour samples are and invite the people who currently hold them to send them to this address, then that's no doubt what we'll be doing. But yeah. Yeah, if they've got big enough samples, yes, I think you can. I mean, the sample at the moment, for example, that's been removed this week, currently is in Sutton, where there is a team of researchers who have said they want to work with us, although obviously we haven't yet determined what the research might be. So in my head, it seems a bit crazy to sort of send the whole sample somewhere else when they're going to want some back anyway. So perhaps they store some there and send the remainder to Newcastle. But that might not be the correct protocol. I mean, human tissue is a very sensitive area, and there do seem to be an awful lot of, there's a lot of legislation and rules that you can fall foul of if you're not careful. So I just need to make sure that Andy Hall advises us on the best way to proceed with that, I think. All of it, I think, yeah.
Everyone saves it, don't they? I mean, I know my tissue is down in a basement somewhere in Sheffield.
Yeah.
And presumably that's the same everywhere in every hospital.
Yes, it's safe, but it doesn't give you a sort of license to use it.
No, I know that one can
Yeah.
ask the
You can ask
pathologists
it, yeah.
to release it. So
Yes.
there's already, what, 90 samples here?
Exactly, yeah.
Mine specifically said that I would allow it to be sent to many different research facilities.
Okay, right. Thank you.
Right. Well, I'm absolutely amazed at the amount that Jayne has achieved. I mean, she set off really trying to find support for Eve. And as the result of this initiative, we've all benefited because we've now got the possibility of special commissioning. And this has really all come from what Jayne has done, trying to get special commissioning for the PAWS-GIST patients. And it had a spin-off for all of us, which I think, assuming that we get it, should make a huge difference to the way GIST patients across the country are treated. And the tissue bank is another spin-off that's happened because of what Jayne has done, and I think I am very, very grateful for her contribution, and I'm sure we shall be hearing more of Jayne in the future. So thank you very much, Jayne. Thank you very much, Bas.